Hi, I'm Aaron Baudet, owner of MedicarePrepare.com. I work together with my son Travis, and welcome to the 2023 version of how Medicare works. Medicare has not changed much in over 30 years. The numbers change every year, but the configuration and the structure has remained pretty much the same and intact. They've added a few things. This is going to be a toned down version. My objective here is for you to understand or be able to understand in very easy terms, because my customers tell me this really made it easy for me, how to understand Medicare. Because once you understand how Medicare works, then you can determine, hey, what's right for me to mitigate the costs that Medicare isn't going to pick up, because Medicare is not going to pick up everything. They do cover a lot of items. Few of them do they cover in full. So there is some financial risk having only original Medicare. So I'm going to do a three-part series. I'm going to talk about in this video Medicare Part A and Part B. In another video, I'm going to talk about how supplements work. And in the third video, I'm going to talk about how Medicare Part C or Medicare Advantage works along with drug plans. I'm going to try to do this in under 20 minutes. You can go back and review it over and over again. But as I said, the point is to give you a very brief understanding of how it works, what you can expect, and then we're going to get into the common ways that people mitigate this associated risk, this financial risk with things that Medicare doesn't cover. Okay, so let's jump right into it. Here we go. Okay, the first thing we're going to do is we're going to talk about Medicare Part A. Original Medicare is made up of both Part A and Part B. So let's talk about Part A. This is hospital. This is whether you're overnight in the hospital. It covers a semi-private room and board, general nursing and miscellaneous services, and supplies. It's not a private duty nurse or a television. It's the basic needs. It's your meals. It's everything you're going to absolutely need. Now, the structure of this, as I said, hasn't changed since the inception of Medicare. Basically, they are walking you through, hey, how many days are you going to be overnight in the hospital, and what is their responsibility and what is yours? So if you're in the hospital for 60 days, it doesn't matter if it's one night, if it's 2 nights, if it's 7 nights, or if it's 60 nights. Medicare pays the same. They pay everything except for $1,600, okay? Now, we're going to not pay attention to column 3 and 4 because these are dealing with something else I'm going to go through a little bit later. So it's $1,600. If you only have Medicare and you go in overnight one night, Medicare pays everything except for $1,600. That's a big number. This is why people transfer this risk to an insurance company. Now, if you come out of the hospital for 60 days or 61 days, let's say, and then you go back in, you will likely pay this $1,600 again. It could be collected numerous times within one calendar year. If you're in the hospital, which is rare, more than 60 days, 61 days through 90 days, Medicare pays all except for $400 per day. That's 12 grand. That's a big number. Again, this is why people transfer the risk. Yes, I understand this is rare. I've seen it happen several times. If you're in the hospital overnight, more than 90 days, 91 days and after, Medicare gives you 60 lifetime reserve days that you can use once during your lifetime. And that, you may use them consecutively, you may only need a few of them, but you're only going to get 60 during your lifetime. Under those circumstances overnight, Medicare is paying all except $800 per day. That's a really big number. Those 60 days, 60 times 40, sounds like $48,000 to me. Huge number, huge number. After you use these 60 days, Medicare stops paying for overnight stays in the hospital. Again, this is why people have other coverage to transfer this risk. But generally speaking, most people do not stay in the hospital long. Once you are stabilized, you're not going to die. You're no longer acute. Many times people still need care. Maybe they can't go home. There's nobody there and they need to rehabilitate. They utilize skilled nursing facility care. And if you meet Medicare's requirements, meaning you've been in the hospital for at least 3 days, and you enter a Medicare-approved facility within 30 days after leaving the hospital, you would fall into their coverage. Now, with their coverage, the first 20 days, Medicare is going to pay all the approved amounts. So you're not going to have anything left to pay. If you're there longer than days 20, from days 21 to 100, there's a copay of $200 a day. Again, this is a huge number, $16,000. And this is for the person who maybe had a stroke or broke a hip or a leg, needs to learn to walk or talk again, and it's going to need some care before they can get back up to go back home. Skilled care. This is not convalescent care where you're in a place you're going to remain for the rest of your life. Many of these skilled nursing facilities are in hospitals. They're on a different floor. Maybe they're a separate facility. It could be anywhere. Beyond blood deductibles and hospice care, this is the meat and the potatoes of Part A and how it works. You can see what your risk is because they're going to pay everything except this. I'm going to go over how to mitigate these costs in the next video. Moving on to Part B of Medicare. Okay, this covers medical services. We're talking about physician services, inpatient, outpatient, medical surgery, supplies, physical and speech therapy, testing, durable medical equipment, CPAP machines, those types of things, walkers, wheelchairs, those are durable medical equipment devices. For 2023, there's a deductible of $226 that must be satisfied prior to Medicare paying anything. After that, Medicare pays, they're saying generally 80% of what they approve. You pay the other 20% if you don't have an outside source to pay for it. We're looking at this particular plan. I'm just showing you this so you understand how Medicare works. So I'm going to get into the ways to mitigate this down the road in the next video. Now, if the doctor accepts assignment, he's agreed to accept what Medicare approves as full payment, of which they're going to pay generally 80% of. So this is key. Most doctors, I find these days, will accept assignment. They also call it participation with Medicare. So if there's maybe make this up, a hysterectomy, the bill's $10,000. Medicare says we approve $6,000 based on your zip code and the procedure codes they gave us. Medicare will pay 80% of the $6,000. The 20% you're on the hook for. If you have other insurance, that may pay all or some of it. That's something important to know. If the doctor does not accept assignment, there can be excess charges. Those are above Medicare's approved amounts. These amounts are mitigated these days. They're not allowed to charge very much beyond what Medicare approves, but it's highly unlikely. It's very rare that I see this. I've seen this twice in the last 20 years. Back in the 90s, I saw it a lot. But Medicare did a good job getting this under control. Part B excess charges, Medicare doesn't pay any of because they don't approve it. It's above what they have approved. So this is just something to be aware of. That does occur in rare circumstances. Usually you know it up front because most surgeries are planned. If it's not planned, then that's a different story. So this is the bulk of Medicare Part B. Medicare Part A, if you have 40 working quarters, there is no premium for it. You are fully vested in the Social Security system. If you're not fully vested in the Social Security system, you can still buy Part A, but it's pretty costly. Part B has a cost associated for 2023 of $164.90 per month. That's the typical premium. If you are a high income earner, you will likely pay more. If you are a pretty low income earner, you can get out of the premium completely. Those are things to note. We can talk about those specifics another time. Right now, I just wanted to go over the meat and potatoes of Part A and Part B. If you are collecting Social Security currently and aging into Medicare, generally speaking, you're auto-enrolled in Part B of Medicare. If you don't want Part B of Medicare, you can send back the card with your signature and you can opt out of Medicare Part B. And if you do get into it in the future, you want to make sure you've had creditable coverage the entire time, or else you can face a penalty. And it gets stiffer the longer you wait, and it sticks with you, for life. So it's it's really, it can be a bear. I would be very careful. Make sure you understand how this whole thing works. That's why I always suggest you work with Travis, myself, or somebody like us. Right now, we're working mostly in New York State. This is our focal point right now. If you have questions, you can put them in the comments below. You can reach us by phone or by email. And we're here to help. We're here to help you understand how things work. Because it's really difficult to make educated decisions if you don't understand how things work. And, we're trying to give you a bird's eye view, make you comfortable with this so you can know what to anticipate. Okay, next video is going to be on how supplements work, which is going to be an important discussion.